August is a time where we recognize International Overdose Awareness Day, and researchers at the Rutgers Addiction Research Center, or RARC, at the Brain Health Institute are doing a lot to try to understand what the underlying factors of addiction. I'm Kristina Jackson. I am a professor in psychiatry and the Associate Director of Epidemiology, Etiology, and Prevention at RARC. And my work studies the etiology or the risk factors underlying addiction so that we can understand what factors to target in prevention programs, because the best intervention is prevention. I'm currently conducting a study on adolescent exposure to alcohol content in the media, and we're asking high schoolers to let us know when they come across alcohol content in their daily lives. We're also asking them to upload images or screenshots when they come across the content in YouTube, social media, TV, that sort of thing. And we were astonished by how much they were reporting coming across. And when we asked them, they were really surprised too by how much content they encounter in their daily lives. So we're currently working with the high schoolers to try to identify ways not to change what they're seeing, but to mitigate the impact of what they're seeing and its influence on their own drinking-related behaviors and attitudes. We're currently doing a study where we're looking at youth with autism, specifically the prevalence of alcohol and other substance use, because really not a lot is known about this population. And what we find that with, I think because of greater acceptance and less stigmatization, that youth are actually drinking at relatively levels that are relatively normative. So over the past 2 decades, my work has focused on the initiation and early use of alcohol and other substances. Youth experimentation with alcohol is considered normative, and a lot of individuals who drink early or use substances at a young age do not go on to use substances heavily or have problems. But a lot of people who are diagnosed with a substance use disorder do begin using substances at a young age. So it's really important to understand early use. So the why, the where, the how, the when. So to look at this, we conducted a long-term study of middle schoolers who were followed through high school end to understand the factors that increased risk for heavier use. We surveyed them regularly, so every couple of months over a course of a couple of years. And we found that the most important risk factors were having friends who drank alcohol, experiencing negative life events in childhood, and also alcohol-related parenting, so whether they communicated with their parents about alcohol and whether parents set rules about alcohol. So it's really important to understand these factors because adolescence is a great point for prevention, a point where we would want to intervene so that we can preclude progression to addiction.